Hey everyone, it's Dr. Andrew Orr here. Today I was actually coming on to do a blog and I thought, you know what, I'm not feeling the greatest, so I thought I'll put it off till tomorrow. And then I thought about it and I thought about what a lot of people, especially that visit my page, go through and a lot of the disease states and stuff that they suffer on a daily basis. And how we all put on a brave face sometimes. And so I often talk about that people don't know. And I've talked about this in endometriosis posts, and I've talked about it in pain posts. I've talked about it in all kinds of posts to do with chronic pain, chronic disease management. So I thought rather than put off till I feel great and don't look like death warmed up, I'm going to come on here and speak about on those days that it's okay not to be okay. But the purpose of this blog really in today and to speak about is that we can't always manage our disease on our own. Now, I'm sitting here thinking, how the hell am I going to get through this? I'm in pain at the moment. I feel like rubbish, and my glands are up. As you see, my face is all swollen, and I tell people that I have a chronic disease state that it's very much like endometriosis, but it grows up in my sinus cavities. I've had 7 operations on it, and I'm looking at my 8th. Because of the pain and symptoms have got to a point where it's unmanageable and where medications and all the conservative managements aren't going to work. And this is what we actually see with many disease states. And I suppose I'm on here to explain to people where I've talked about that expectation versus reality. And the truth of the matter is that some disease states, it truly is about managing them, and that surgical intervention is just one part of it too. It isn't going to fix your disease state. When we look at endometrial, we have to be very honest, and some other disease states, we have to be very honest that it can provide symptomatic relief for a little while, but then you have to do other management on top of it. And even with the best medical interventions, we know that some people are still in pain. And this is why I talk about a multimodality approach. And then people say, well, why aren't you doing that? Well, I am. The point is that even sometimes with the best management, that we're all going to have bad days, and you have to be real about that as well. And I want people to know that. The other part, the true part about this, and sorry if I'm a bit dazed and confused as we're doing all this, but I'm not on the ball like I normally am. But probably people looking at me will go, well, looks okay to me. Yeah, try living in my head at the moment when you're taking, pain medications and you're on different forms of stuff. Even today I'm on antibiotics because of it. But and steroids as well. It's great. It's fantastic. But even so, I try and keep an optimistic, cheerful part about that, because with pain, when you go into that poor me mentality, pain becomes worse. And by the way, I don't want people sympathizing with me and pouring out the sympathy vote. That's not what this is about. It's actually to actually empathize with people that go through pain, but also be realistic and come from a point where a person that lives with chronic disease and chronic pain each day can understand what you're going through, because I go through it too. But I'm also trying to get through to people that you also have to be realistic about that you can't do it on your own. And because a lot of people sit at home and go, oh, Dr. Google. Now, Dr. Google's the biggest piece of rubbish going. And honestly, most of the information on there, I'm going to swear now, it's shit. You can look for all the blogs and all the posts and all the things like that. Unless it's coming from a healthcare professional, a lot of the information really is substandard, and then some people have got, you know, got an understanding of a disease, but like me, I might have an understanding of my disease, but that's not my specialty area. So I understand it, but it doesn't make me an expert in it. And in saying that, I went and saw my expert today. So I turned up at my specialist this morning, colleague of mine, and he looked at me and he said, this is a bad day. He said, I've never seen you like this. I said, yeah, it's a bad day. I said, you're used to seeing me put on a brave face and come in, but I said, I come here on a bad day because I actually feel like crap. And that's when you actually should go and see you. Don't wait till you feel good. Well, you should go when you're good as well, because then you want a management while you are good and then not. But I said, look, today's a bad day. And he said, you know, one of the things that we all need to understand, he said, I've just had a patient in, and they're very similar presenting to you, but maybe not as bad. And the patient's going, well, I want you to fix me, and I want to have my sense of smell back, and I want this back, and I want to be able to taste food again and stuff like that. And he said, well, the reality is I can't give you that guarantee that that's going to happen. He said, we're going to go and do some surgery to open up your sinuses, and we're going to open up your airways. He said, really, our main thing is to open up your airways and make you feel like you can breathe again, and so your head's not pounding and all kinds of stuff. But he said, as far as getting your taste buds and all that back, we can't guarantee that. He said, we then have to do management on top of that, and then hopefully by managing it, that some of your taste buds and your sense of smell and all that will come back. And the patient was really upset about it, and he had to sit him down and explain the harsh reality that he has a disease, and it's that disease has caused a lot of damage, and that damage might not be repairable. And then the patient said, well, I'll just go off and manage it myself. And he said, mate, you're not going to manage this yourself, and you have to be real about this, because what's going to happen is I'm going to see you back here in 2 years' time or 12 months' time, and you're going to be back where you started. You've got to go and have the surgery. That's the only thing that's going to fix this. Because he was trying to get out of surgery as well. And that's the reality. Even for some people that have things like endometriosis, the reality is, yes, they have had surgery before and they may need it again. And then we've got the reality is that some people are really restricted by their demographics, by their income, and by the services that they have around them as well. And yeah, it's not fair. Like, to be honest, it's not fair. But sometimes I get people throw mud at me and go, well, you know, I can't afford this, and you're telling me to do this and blah, blah, blah. And, you know, what would you know? And I understand where they come from, but at the end of the day, we can't also project our issues onto a healthcare practitioner that's trying to help us. Just like, you know, this colleague of mine was saying to this patient, was trying to project it all onto him like it's his fault. No, it's not. It's just life. You know, some of us have got hereditary issues that get passed down, and a lot of diseases are hereditary. You know, like this may be hereditary. Endometriosis is hereditary. A lot of, you know, things like polycystic ovaries are hereditary, and there's things that get passed down, and they're genetics. And unfortunately, we can't blame our parents either, because their gene line has come down that way as well. So it's a tough issue. And again, when we're limited in services, and some people don't have private health insurance, and I feel sorry for them, that, and they're jumping up and down going, well, I'm not getting the help I need. And I understand that, but that's all you've got. If you can't afford it, you have to go through the public system. And unfortunately, the public system's not always great, and there's not always good specialists. But what I tell some people is, you can do this. There are some private people that do public work and will see you, and you have to see them as a private patient and pay for it, unfortunately. And then they can put you on public lists, and that's another way you can do it. and some of them will help you in that way. Unfortunately, they are few and far between. But then I also see the other side of it too, that some people are told to do treatments and they don't always do it. Or even my own patients are often, oh, I forgot to do that, and I haven't been doing it, and I've been on a bender, and I've been, you know, on the alcohol, and oh, I haven't been taking my medications because it just doesn't, you know, nothing's working. And we often have to sit down with those people and go, well, hang on, it's not that they're not working, it's just you're not taking them, and you have to take them for them to work, and you can't take them sporadically. So that's the reality as well. And I know, you know, sometimes I haven't been 100%. When you're feeling down or you're feeling unwell, you often don't feel like taking medications, and some days you can't. You're just like, oh God, I don't even feel like eating anything. So there's those days too. So I get where people get to having suffered a chronic disease, and that's why I'm talking to you in this state that I am. And you might not realize, but you know, with the glasses on and take the glasses off and all the puffy eyes, and if you were living inside my brain at the moment, it might not be a wonderful place. And we see that with people that are in chronic pain, and they look great and all vibrant and stuff like that, but in the inside, they've got a world of hurt. But it's a big issue that we see people that aren't getting the right help as well, like I said, and some of them are limited by their demographics, they're limited by the services, they're limited by the practitioners they have around them, and that sucks too, and I feel sorry for them. But, you know, that the other side of it too is sometimes it might mean that you have to go outside your demographics, and then people say, well, I can't afford that. And I feel sorry for them too, because then they can't. So you're limited. But at the same time, there are services, even if they are limited, they can help you to a point, and you just got to rely on the services around you. But thinking that you can do it all on your own is one big giant mistake. And also sitting at home on your own, in your own head and your own disease is a big mistake too, because the more that you isolate yourself, then the head and the mind starts ticking over, and then you're living in your constant disease state. And I've talked about this with anxiety before, because anxiety is a big fuel for a lot of chronic pain. And in your own headspace, it doesn't help. It actually makes it worse. So there are apps out there now, like I noticed the Curable app. It's a great app that I tell a lot of my patients to get, because it talks about learning to live with chronic pain, and there's lots of meditation techniques and quietening of the mind and things like that. If you don't have access to counsellors and services and things like that, always have a counsellor too if you can. Now with online, a lot of counsellors are doing online consults. I do online consults to help people remotely as well, because I realise that some people can't get access to that. And then the last bit too is just be careful with Dr. Google, because a lot of information is there, and just be real that sometimes pain is going to get to a point where you are going to need help. And you know, it sucks. It does. I understand when people go, it's not fair, it's not fair, it's not fair. No, it's not fair. It isn't fair. But what you have to do, you realise that you're in an acute phase. Your disease has become chronic. It's also become unmanageable, and then you have to seek help. Now, even if the services aren't great where you are, and you know, whoever you're seeing is not the best at whatever it is, at least they can offer you some help. Some of them might be able to tell you to go to a different state, out of different town, whatever, but see the right people. And just remember, there's some good people out there, the right people, and it means you have to go and search for them. But whatever you do, don't sit at home on your own trying to manage your own disease, because you can't. Even me, with all the information and all the education that I have and work in the profession of healthcare, I can't manage my disease myself. And you've got to be real and be realistic about it. You've got to seek intervention. This is why I'm always talking about early intervention is the biggest part of disease management. So the younger that you get onto disease like endometriosis, the better your future outcomes are, fertility and other things. So I wish when I was young, I accessed things a lot sooner and, you know, knew what things were going on. But, you know, as you get older and wiser. But the other part I want to say to people, it's okay to not have a good day. And what you do is you go and rest and repair, you take your medications, you do whatever it is you can. And then when you're feeling better, then, you know, you move forward, but seek help. And even when you're in your worst stage, it might mean going to an accident and emergency, or, you know, the ER and things like that, because they can help you get out of acute pain. You know, when I've talked about this in other blogs, when you go to the ER, they're not there to fix your disease. ERs are not there to do that. They're there to get you out of acute pain, fix you up, or you've come in an accident, patch you up, and then refer you to other services. So there is that part of it too. Big part, but we'll talk a little bit more about these sort of things later, but I just wanted to come on and talk about it while I wasn't feeling so great, so that you will understand that the days that you aren't feeling so great, that it's okay. Everything's going to be okay, but you can't do it yourself.